By now, you've probably heard the headlines.
The shortage of family doctors is a national problem. More than 6 million Canadians don't have one.
I've been promised universal health care, and I feel I've been lied to.
A system that relies only on doctors is not going to be able to get us out of this crisis.
And if you spend a day in the life of a family doctor, it's easy to see why.
It's a sense of dread in some ways. It almost seems like you're patching holes of a dam that's going to burst open. It's going to make it very hard for me to sell this to young people to say, come and be a family doctor like me, because you're going to end up getting burnt out, washed up, not have the work-life balance. Do you really want this?
But there is hope. There's a lot of innovation, and the changes to how we do family medicine, they're happening lightning fast. So let's take a look at which ones are actually working and what's being done to solve the family doctor shortage. Remember in the early days of COVID, how everyone was scrambling to adapt? We kind of reimagined how we did everything. Appointments, those started to move from the examination room onto your laptop screen. In some places, that idea, it never went away. In fact, some places took virtual care and then turned it into a building block for a system that's now connecting tens of thousands of patients to family doctors. Renfrew County, it's a little over an hour west of Ottawa. 1 in every 5 residents here don't have a family doctor. And it's a lot like dozens of rural municipalities across Canada. No walk-in clinics, no urgent care clinics. And if you don't have a family doctor here, chances are you're going straight to the emergency department. But the challenges of COVID, they kind of created an opportunity. And now healthcare is being delivered here in a way that's never been done before, not quite like this.
Hi, Jillian. My name's Dr. Ragalska. Okay.
This is the Renfrew County Triage Assessment Center, also known as VTAC. It's a hybrid model of team-based care. So here's how it works. Let's say you need a doctor. You call a 1-800 number.
Good afternoon. Thank you for calling Renfrew County VTAC. This is Melanie. How can I help you?
The first person you talk to is a medical receptionist. They're trained to know the ins and outs of the healthcare system, so they know exactly which provider is the best person for you to see in the shortest amount of time.
Hi, I'm Sean. We're going to take you on in and get you started here, okay?
Paramedics and nurses. These are like the second layer of the VTAC model. In some cases, they're going to do house calls. They'll come to you bringing that healthcare into your living room. At other times, they're going to ask you to meet them at a nearby clinic. And that is where the doctors come in.
Jillian, how long have you been sick for?
The third level of care. Paramedics and nurses use Bluetooth-connected medical instruments. That way they can become the eyes, the ears, even like the physical hands for about 24 doctors who are working virtually from across Ontario.
So we do a full assessment, and not just for the doctor, but for the patient. We can show them on a high resolution video. The doctor then can see in their ears. This way, if they come in and they're running a temp and we listen to their lungs and it's symptomatic of possible pneumonia, we can get a rec drawn up and circumvent going through the emerge for hours and hours and just go directly and have an x-ray. Also have a prescription filled like that.
VTAC has created a system so efficient that most people see a family doctor within a few hours of having made their call. So blood samples, pap tests, physical assessments. Paramedics and nurses, they can take all of that extra work off of the shoulders of the family doctor. And that's one of the reasons that VTAC has logged some 80,000 family doctor visits in the last 3 years.
Have somebody in and out within a half an hour versus many hours. So hopefully it takes the load off the emergencies and the stress off the patients.
And here's where it really stands out. Unlike your typical walk-in clinic, all of your health information, so the test results, the blood work, the doctor's notes, all of that, it follows you from doctor to doctor into future appointments and eventually to your own family doctor once you finally get a permanent one.
Every physician who uses our system, who's on with us, has access to all of your labs, all of your information. It's all here.
And there's another thing that stands out from their solution. The doctors that work there seem to love the model so much, they don't have any trouble keeping the doctors they have or even recruiting new ones.
The only reason we've been able to recruit a pool of doctors to do this long term and maintain them is because it's professionally rewarding work. they enjoyed it. If people didn't enjoy it, if this was just too much, if this brought nothing to you professionally, it'd be really hard to keep those doctors. This isn't the final sort of end point that we want to be at. This isn't the solution to the problem. It's not comprehensive team-based care. But as a bridge to that point, as a safety net, we feel that we've been able to tap into an unmet pool of physicians. So we're not poaching anyone from another community.
It takes the pressure off many of the doctors in the community as well. Those doctors, those emergency departments are handing out VTAC cards to the public to say, look, my roster is full, my waiting room is full, the wait's going to be hours and hours. If you call this number, you can talk to someone today. They can get you started in the healthcare system to take care of whatever your issue is. That's a powerful tool. And when we talk about the return on investment associated with that, it's not about saving money in the healthcare system, it's about saving the health and prosperity of Ontarians.
By their own calculations, they've saved Renfrew County some $2 million a year in healthcare spending. And the Ontario government, they just approved $3 million a year to keep them going longer term. The people at VTAC, they call that proof that their model is working. Now, whether VTAC is a solution or a bridge towards one, the reality is this: it costs a lot of money up front. And that's the thing. Every single researcher, family doctor I've spoken to, they have a lot of different ideas, but two things that they agree on unequivocally. One, any solution is going to cost a lot more money up front. And two, there's no question that we need to switch to some form of team-based care. Team-based care. That term comes up a lot in this conversation. Here's how team-based care works differently. So imagine a typical 30 patients a day. They bring all of their problems to one family doctor. If you increase the flow, things start to really back up, and pretty soon they're overflowing. Team-based care is designed differently. It is streamlined. And so you can think of the nurses, the physiotherapists, the social workers, the dietitians, they're all forming that team. And so if you take those same 30 patients, figure out who is best suited to address their issue, when you do see a family doctor, all that doctor is focused on is doing what doctors do best: clinical work, interpreting the test results, and seeing a lot more patients. And there is evidence to suggest that team-based care works. When Ontario tried it out, researchers found family health teams allowed doctors to provide more care in less time. In Alberta, 2 team-based care clinics ended up saving the province $120 million over a 10-year period. But here's the catch. In the Ontario example, the province didn't see those savings right away. And so the funding taps were shut off abruptly in 2012. The government just couldn't justify the increased upfront costs. And the researchers I spoke to say 10 years ago, those decision makers, they may have missed the bigger picture. That bigger picture is savings in other parts of the healthcare system over the course of time.
The crisis that we're in right now with primary care has been a slow burning crisis that suddenly became a catastrophe in recent years. And so it's going to take a lot of time for that to unwind, and it's going to take more than was necessary if we had intervened sooner.
But the change that doctors like Alika Lafontaine have been advocating for, it's happening faster than ever. Just take a look at what's happening with their licenses. Because in Canada, you can usually only practice medicine in the province that you're licensed. So it's really hard to work across provinces or to work across territories. But in recent months, those barriers have been coming down like dominoes. Legislators in Atlantic Canada have removed licensure requirements across all 4 provinces, so doctors can now work freely wherever they're needed most. BC and Ontario, they're following a similar route, and they're expanding that idea in some cases beyond Canada's borders. If you're a family doctor working in the US, Ireland, Australia, or Britain, Ontario is rolling out the welcome mat for you to practice anywhere in that province. The ultimate goal, according to almost every doctor surveyed by the CMA, is this: a pan-Canadian licensure, one medical license to work anywhere across Canada.
So what does this mean for patients on the ground? Those clinics that shut down when people take vacation, they're going to have an easier time getting visiting physicians to come in and actually staff them. When you have doctors across those 4 provinces wanting to come together to open up a virtual clinic, that opportunity will now be there. these things together, they all synergize and amplify the ability for people to access care, and that is going to make a difference in how long you wait.
So if you've got doctors starting to work freely across Canada, you've got a significant push towards team-based care, and the innovation to bring all of that together, what's standing in the way? That's one of the top questions on the minds of researchers in Kingston, Ontario. It helps that the Dean of the Faculty of Medicine at Queen's University just so happens to be a family doctor for 4 decades. Oh, and Canada's former federal health minister.
So we have never had universal access to primary care in this country. We've never been able to say every single Canadian has a primary care home or a family doctor, but it's never been as bad as it is now. We've reached the point where less and less medical students are choosing family medicine, and more family doctors are retiring, and of course the population is growing and aging, so we've reached a real crisis point.
Dr. Jane Philpott is tackling, among other aspects, the supply side of the problem.
We are actually starting a new campus in September, and the students who go to that campus are students who are committed to becoming family doctors. And they will have a family medicine focused curriculum and go right through to residency, and we hope that almost all of them will in fact become family doctors.
It's a twofold plan for the future: boost the number of family doctors and redesign the system that they're ultimately going to practice in. For that, she says Canada should zoom out and look at how other countries do family medicine.
I'm very interested in the UK model, the national health system. People who live in the UK will say it is not perfect, it has lots of its own faults, but it's an interesting model where when you move to a particular community, you are told that's your postal code and therefore that's your primary care home, that's where you're going to go and get care. We've figured out a system. If the population grows, you build another school. If the population shrinks, you close one down. Why can't we develop primary care systems so that everyone has a primary care home? Lots of countries do this. We're actually paying more than we need to, and we're spending our money on the expensive things that could be avoided if we actually had access to primary care. I think we could lay out a plan to get to a far better place and have the work completed in a decade.
Think that's going to happen?
I am going to keep working at it, and I know a lot of other people that are determined to work at this, and it really matters to the future of our country, so let's not stop till we get it better.
Just going to take your temperature too, just relax your arm, just like that, all right? 38.7.
So what does this all mean for you or for me right now? Well, there's a lot more to the big picture fix. But experts say, best case scenario, it's going to be another 10 years before we each have a family doctor. In the meantime, some of us might luck out on one of the newly funded models popping up in our communities. Others are going to have to depend on innovative solutions, things like VTAC.
Stick your tongue out and say, ah. So you can see like her tonsils are quite infected looking. Are you getting a good view of that?
Kind of like a treatment to the problems in primary care to keep us going until we've got a cure.